Hello everyone, my name is Omar Alonzo and this is my HCC Health Career Connection video project. I was born in El Salvador and I moved to San Francisco 8 years ago to the Mission District. That's where I started to learn and observe a lot of health inequalities, poverty, and different issues that we talk about today. After that, I went to UC Berkeley where I studied public health. I became really interested in the intersections between medicine, policy, and the way in which we approach societal issues. Some of my future career goals include getting an MPH, but I'm also considering other degrees such as a Master in City Planning or Masters in Public Policy. I am really interested to learn different ways in which we can continue exploring healthcare, increasing access, and increasing equity for all communities and addressing health disparities. I was really interested on being part of HCC based on some of the conversations I had with my friends and some professors. They told me they had a great experience with it and they told me to apply. When I started the application and the process, I was always thinking about how I could gain a different type of experience via HCC and how we address a lot of the health inequities and all the issues that we talk about in class and research in a professional field and in everyday life. As part of my internship at Kaiser Permanente Regional Health Education Department, I had three projects. One of them included rebranding the Spanish YouTube channel, what to organize, categorize, and make a lot of changes on the YouTube channel to improve user experience. The second project consisted of creating a style guide for linguistic approaches and linguistic formats. It was important to create this to develop multilingual and multimedia content, which was utilized a lot in the YouTube channel, the different flyers, and other sources of information that we provided to patients. For my third project, I worked with clinicians in another department which focused on quality and operations to create a survey and a literature review to identify perceptions and behaviors, as well as some barriers to inhaler use among Latinos. The purpose of my participation and my input in this project was to identify different barriers and aspects that they could treat and change in patient experience elements to increase adherence in medication. When I think about the impact of the work that I was doing, I think about the impact of the YouTube channel in particular because of the way in which it was able to approach different and different ways to promote health education, overcome language barriers, provide culturally responsive care, and also expand the way in which we do outreach to different populations that need this care the most in a way that's the best for them. I think that organizing multimedia content allowed me to understand another barrier that healthcare has and ways in which you can create new technologies and different implementations to improve care delivery. This experience allowed me to learn the way in which a large organization like Kaiser Permanente delivers care, champions communities, innovates healthcare in the United States, and expands access via different methods, practices, and systems. I think that in particular where I learned the most and the main takeaway for me is seeing a lot of the work that's going on behind the scenes when it comes to the patient coming to the doctor and providing them with the resources and healthcare and everything that they need for them to be healthy, happy, and live longer. Lastly, I want to thank HCC and Kaiser Permanente Oakland for allowing me for this opportunity to intern, learn, expand my knowledge, and be immersed into a different realm of healthcare and learn and value a lot more of what health education is. Thank you.